Thank you. Good afternoon, everybody. I must thank at the outset Dr. Gagan for giving me this opportunity to stand before you and the AIOC as well. So the topic given to me is how to prepare an ACE NABH assessment, important do's and don'ts during assessments. Basically, during any assessment, we have two people to visit us and everything to be prepared and to be displayed within 1.5 days. So those two person is going to take care, like the process is examining the documentation, all those legal and legal SOPs, and then is the physical verification, visiting of each and every part of our hospital, the process, and they would go through from outside till the depth of the institution. So I would try to cover maximum possible, and there is an overlap also, like creating those instruments, then assessment of those instruments would be overlap, and I'll go stepwise. So the first of all, as has been told, what we need to do for the NABH assessment is we want to have the insurance or we want to add the quality. I believe if we want an NABH assessment or prepare for the NABH assessment, the first thing we must learn, we should have a quality issue with us to improve on the quality. So mindset to NABH accreditation, we are working for the quality. To procure NABH assessment book, as Dr. Gagan has already shared with you, to identify key person in your own institution those going to look into this, identify core area where we need to work on, take all employees along, because everybody has to be involved into one or the other part of the working of the hospital, otherwise it's going to get us NC anywhere. And then you submit the application, reach NABH website yourself, search your own login and password so that it's procured with you only, and as and when you need, you can go into that. Do not be dependent upon third party, as most of the institutions they do it. Do not take someone else's SOPs, because most of the hospital we go, SOPs are belonging to somebody else and your institution is totally different. That's going to create a chaos. Do not let third party to control your password login ID. Like you have to update your login ID and maybe you are into trouble in future. Do not use third party manpower, because usually they would give you for 3 or 4 or 5 days and they are not concerned with your institution, they are not concerned with your quality of work. They just want for the assessment to be conducted in the way they wish to. Do not waste time during assessment. Most of the time, as I've told you, we have to go all across the areas within a limited time. So if we try to waste the time, it's going to compromise the assessment. Do not gift anything to visiting team. Focus is the patient safety, staff and employee safety, environment and community safety, information, education and communication, measurement of performance, what we do, organizations around important functioning, and key person to start with this identification and responsibility to share with them is the MD CEO, overall responsible for everything. Then we have an NABH coordinator, quality manager, which is a key person, I should say, responsible for quality upliftment, identify, create SOPs as per as you need, training of the staff, monitoring of the working, and then audits. ICN infection control, awareness about prevention, hand hygiene, SSI, etc. Safety officer to facilitate facility safety aspect from all aspects to be a safe organization. MRD in charge for statisticians, pharmacist, responsibility, store in charge, and counselor for the smooth working and day-to-day working. Identify and document vision, mission, statement of the registration. Prepare SOP of your own. Identify core area, distribution of different responsibility to different person. So one person is responsible for a specific thing. Education and training of department leaders, like one person in the reception area, one person in the initial assessment, one person in the OT, one person in the medical record, one person in the HR, who is given a core responsibility to train their own person and monitor daily working. Identification and procurement of all related statutories towards law, regulations, formulation of committees with their heads, distribution of responsibility towards preparation and conduct of assessment, and core areas, scope of service, what actually scope we have in our practice. Maybe we are eye care organization, maybe we are not doing vitreoretina, maybe we are not doing oculoplasty. So exactly what we are doing is the scope you provide, and specifically to the pediatric care, what amount of pediatric care we are giving to give it, and that has to be displayed. Patient registration process and space for that. Patient care area, care of the patient, where you have to take the OPD, the procedure, all those areas specifically for those, lab and x-rays, investigations, whatever is related to that. Operation theater has been very well covered with Dr. Kumaran, and CSSD along with the theater, MRD and store and record. Key areas for the hospital infection control program, biomedical waste, facility management, facility rounds, which is has to be specifically charted, fire safety measures, vulnerable patients and their care, emergency care, tries epidemics, during epidemics, patient right and responsibilities, management of medication, biomedical engineering services, mock drills, code blue, fire, child abduction, has to be aware, done, audited. Information technology, education training of all concerned staff members. It's our responsibility to train and educate all of them, then audit them towards their responsibilities. Audit and documentation of all above. Whatever we are doing, giving an education, we need a documentation, because that's going to give us our raw work, whether that's been done actually or it's been just created. Self-assessment toolkit. Farm committees, multiple disciplinary team for NABH implementation, quality committee, safety committee, infection control committee, pharmacy, and farm subcommittee in your own group. During assessment, this is what we need to look before we go in for the assessment, and during the assessments, go through the mailed guidelines for the assessment by the team. The team is going to give you guidelines. This is the process, this is the time, these are the assessors, this is the way we would go to. So reach to team for brief process. All documents prepared, displayed, easily accessible by the assessors. Wherever you provide them a room, all those SOPs and documentation should be ready for their use. Whenever they want, you are easy to drag this out and give it to them. Entry-level online preparations, dedicated mobile. If it's an online, let's say for entry-level, you need to have a dedicated mobile with no incoming calls, with good quality camera, because it has to be documented there at the NABH. That's what is being photographed there. Area to be visited, well prepared, informed beforehand, so that we can save time. Office arrangement, adequate size with the following infrastructures: computer having USB and CD writer with a print facility and internet facility, because now we have to upload the online. Punching machine, stapler, highlighter, gum, tape, scissors, 2-3 writing pad and cardboard, because we have to go for the observation. The cardboard is going to help us for our own help. Ready with the mock drills. Anytime the assessor, they can ask you for the mock drills, which we are already prepared. Waste no time here. And in the opening meeting, to begin with, there would be an opening meeting. In opening meeting, all concerned, including leaders, quality person, all departments concerned, area heads should be there. We were going to share about hospital name, location, city, state, legal identity, registration authority, covered area, scope of services, number of beds, number of OT, number of surgery, number of consultant, doctors, nurses, different MOU which we have in the outside, legal compliance status with date, when it has been to be renewed, what it has been renewed, innovation and achievements of the organization. After the principal assessor address, documentation to be kept ready, scope of services which they need to carry along, copy of an updated summary list of licenses with the indemnity form, scope of opening presentation and quality indicator, list of doctors, nurses, technical staff with the qualification, designation and state registration. During the facility round, that would start from the outside of our hospital, right from the display of your boards, display of a SCO name, original language, display of a scope of services, display of a consultant's name, display of vision, mission, display of patient right and responsibility, display of signages like fire, washroom, facility for vulnerable patients like ramp, wheelchairs, special sitting plan, special sitting washrooms. So once you are into a facility round, they are going to watch each and everything all around. facility inspection about safety, fire hydrants, sprinklers, smoke detector, fire exit, fire safety instructions, exit plan.
Shakeen sir, we're running little short of time. If you can finish.
Okay. So I'll just run fast.
Slides and then Sean can finish.
Okay. So during this, they would go to the review process review, staff training observations, staff safe patient transport for area 1 to other, patient interview, staff interview, outsourced staff interview, document check, scope of services, vision, mission, policy, self-assessment toolkit, apex manual, training manuals, quality manuals, induction manual, patient safety manual, infection control manual, drug formulary, drug antibiotic policy, audits for internal, medical, clinical safety and prescriptions, committee meetings, then SOPs. We have our documentation for each and every, what do you call this, chapters. Like for care, for assessment and continuity of care, we have a transfer in out, referral in out, initial assessment, time frame, TUT. Then related to the patient care is the uniform care policy, triage, emergency, code blue, vulnerable patient, discharge policy, restraint of patients, nutritional assessments. Towards medical management is the hospital formulary, purchase, safe storage, handling of medicine like LASA, emergency medicine, policy of verbal orders, high risk medicine, medicine recall, near expiry, safe administration, labeling, medicine error, adverse event, narcotics, policy for implantable prosthesis. Process is important for IOLs. Then for the patient right and responsibilities, basically the right and responsibility to this should be displayed there. Informed consent, list of procedures for consent, complaint and feedback from handling system. Towards infection control, it's been probably covered well. Infection control program has to be there. Surveillance, high risk areas, standard precautions, safe injection and inclusions, cleaning, disinfection and sterilization process, antibiotic policy, laundry, kitchens, housekeeping, sterilization process, biomedical waste, and then the related to quality program, indicator KPIs, patient safety program, audits, incident reporting, sentinel events, and document responsibility of the management, vision, mission, value of the organization, organogram, compliance of the regulatory law and the licenses, scope of services, employee right and responsibilities, and facility management, facility rounds up to date drawing, site layout, breakdown management, management of the safe water, electricity, medical gases, fire safety, hazardous material, identification of any risk. HR is the planning, job specification, recruitment, induction, appraisals, disciplinary grievances handling, credentialing of the people, documentation towards the IMS need of organization, MRD, confidentiality, safe storage, retention policy, destruction, and medical record review, privileging of entry. And that's going to work, see the work instructions like mopping, hand wash, biomedical waste, prevention of wrong side, procedure, etc., material safety, and all the external manuals, your MOU with the others, literature of the medical equipment we use, guideline for the current use, handling, storage, disposals, patient safety aspects, education, identification, audit for adverse event like sentinel event, medical error, fall, needle, stick injury, near miss. All this kappa needs to be. In the medical record,
sir,
usually
can we sum up, sir? We are
just
really getting late.
three slides.
Sir, we have only 7 minutes left for show.
Okay. So there are responsibility of the quality people, admin people, biomedical waste has been well covered, and vulnerable patient, we need to have a wheelchair, ramp, trolley, washroom, assess, infrastructure, all aspects. On completion, online report submission is there, required good connectivity of the dedicated area, HIC quality presentation, KPI are to be uploaded along so as to be ready with this. Team will share this observation before submission. Try not to justify or correct there only. You have enough time thereafter. Look out for your weak areas to focus on for next assessment. Correction worked upon again will go to a PA for closing. Submitted report will go to accreditation committee for final decision. The accreditation committee decision will be shared with you soon. Thank you.